Every 20 minutes, another man will die from prostate cancer. Now, for these patients with aggressive disease, surgery or radiation treatment is appropriate, could be life-saving. But in many cases, patients at lower risk are eligible for active surveillance. We're joined now by Dr. Jeremy Lieb, a specialist in treating prostate cancer, and Al Piazza, a retired phone company manager who lives with prostate cancer. They're here to talk about the latest in prostate cancer treatment. Guys, thanks for joining us.
Thanks for having us.
Dr. Lieb, we'll start with you. How is a genetic test different than a PSA test?
So one in 7 men are diagnosed with prostate cancer in America, so it's a common finding. A PSA test is a blood test that's usually ordered by your primary care doctor, and if it's elevated, it sometimes is associated with prostate enlargement or cancer, and that could lead to a referral to a urologist like me. If it leads to a biopsy and you're found to have prostate cancer, these new genetic tests have been really fabulous to help us understand more about how aggressive your cancer may or may not be. Many men have an emotional reaction when they find they have cancer, and they jump to surgery or radiation, when the truth is the side effects of those treatments might be worse than just living with the cancer, called active surveillance, a process of monitoring the cancer with PSA tests and exams and additional procedures.
Who's a candidate for genetic testing, Dr. Lieb?
So the genetic test is run on the prostate cancer cells. So any man who's been diagnosed with prostate cancer is a candidate for genetic testing. It's not predicting your risk of cancer, but when you're found to have cancer, it's helping you to understand better what's going on within your body.
Now, how did Al's test results guide your treatment decisions with him?
So in some ways, prostate cancer is kind of like NASCAR. It's an analogy I use pretty often in my office. So if you have 8 cars lined up on a track, and you have to try to decide which one's the fastest is going to win, but you can only look at the outside of the cars, the color of the cars, stripes, windows, or wheels, you're not getting the whole picture. And that's what we do with prostate cancer. We look at the cells and try to figure out which one's more aggressive. But genetic testing is like lifting up the hood and looking at the engine, trying to figure out which one's got the horsepower, which one's finely tuned. And that's what the Prolaris genetic test does. It gives me more information as to how aggressive these cancer cells might be. So for example, if you think that a cancer is potentially a little aggressive, and it comes back as not quite as bad as you thought, you might avoid pushing to surgery or radiation, which hopefully protects this patient from the side effects of risks of overtreatment.
Al, we'll talk to you right now. What were the most pressing medical decisions you faced when making decisions?
Well, when I had my PSA test done, which I was not really familiar with, and my doctor says, "Wow, your PSA is a little elevated." I thought, well, what does that mean? So then he started explaining to me what the PSA test meant. So at that time, he referred me over to Dr. Lieb, my urologist, and when he did the biopsy on my prostate and came back with the four worst words that you've ever heard in your life: "You've got prostate cancer." It was pretty devastating. It literally took me to my knees. So now I had to decide what I was going to do to this. And then my first reaction was, let's get it out of my body. I don't want cancer in me. Just take care of this and take care of it now. Well, fortunately, Dr. Lieb says, there's an alternative to this. You may not have to go through this surgery. Let's look and find out what this cancer is all about. So that's when he took the biopsy and sent the sample to for the Prolaris test, and then the Prolaris test came back with results saying that there's about a 3% chance that I may die within 10 years. At that point, everything changed for me. I've seen what it looks like to have the prostate removed and the other treatments, and it was someplace I nowhere wanted to go. So this Prolaris test was a life changer for me.
All right, guys, thanks for joining us. Great information.
Thanks for having us.
Take care.